And I want to introduce you to this concept of frailty. And I should say I'm directing most of my comments to family members, caregivers, patients themselves, and the entire senior population. Frailty is a concept that we use a lot in geriatrics. It's an indication that there is a problem with function. We're having difficulty completing our activities of daily living, such as eating, dressing, toileting, bathing, and so on, which are necessary for us to live alone and independently. This slide shows that there are 3 or more of these signs. This is just one definition of frailty. An unintentional weight loss of 10 pounds in the past year. Weakness, represented by low grip strength. Poor endurance and energy. Low physical activity. Slow walking speed. And you'll notice that each of these is related to muscle tone, muscle mass, and strength. So it's a loss of power, loss of ability to do things. And many times when our frail elders go into the hospital, during that hospitalization, which may last a week or more, they often lose power, they lose tone, they lose function. So what happens when a frail elder goes to the hospital? What happens when they go to the emergency department? What happens when they get in the hospital? What happens when they go home or go to a nursing home? If they're lucky, they'll go to the hospital with a family member, but if they're in a nursing home, often they are left unattended in the emergency room. So you can imagine someone that's not doing well, that may have an acute illness, such as chest pain or an infection or a laceration, lying on a gurney looking up at the fluorescent lights in an emergency room in the middle of the night with all the noise there. And the emergency doctors are taking care of the life-threatening illnesses, so it may be 4 to 6 hours, sometimes 8 hours before we actually are seen by a physician. And in the meantime, we're getting x-rays, blood tests, CT scans, and there's a lot of noise going on. And of course, we're not sleeping, so we become sleep deprived. So our patients during this episode of emergency care often will become delirious, and so they actually are getting sicker, and by the time they're actually seen may really do need to be admitted rather than sent back home. So emergency rooms are really not a good place to go if you're an elder unless it's a life-threatening emergency. Many of you, I'm sure, have had that experience. Now, what happens when we get admitted? Frequently, it's a hospitalist that takes care of our patients. Most primary care physicians now, family medicine and internists, are ambulatory physicians, meaning that they take care of patients in outpatient clinics, and they don't do hospital work. So these patients are then referred to a hospitalist, who are these doctors that are excellent at taking care of inpatients. The problem is that even though they're excellent physicians, they're trained to just take care of the problem for which the patient is admitted. So if you have a patient with multiple chronic conditions like lung disease, heart disease, and the patient's admitted with pneumonia, the other diseases may have a significant interplay, and if we're not attacking these problems all at the same time, we may experience functional decline. The other difficulty is hospitalists don't really know the patient. They don't know the family. They don't know the past history, which is extensive about what this patient's been through. We don't know what the patient's goals and values are. Does this patient want everything done? Does this patient just want to be made comfortable? What are the priorities? What is the value system of this patient? And then ultimately, when we discharge the patient from the hospital, where does this patient go? Do they go to the nursing home, or they go home, or they go to a skilled nursing facility for rehabilitation? Well, what we'd like to see is patients maintain their function and go back at least to the level that they were at before. And this is one of the things that can be accomplished, I think, with the ACE unit, is discharging patients at a higher functional level, and I think we can maintain function better. in the ACE unit because of this model.